What happens when a migraine never truly goes away? When the pain returns day after day, disrupting your life, your work, your peace, and in some cases, doesn't stop at all. Chronic migraine affects millions and is more than just frequent headaches. It's a complex neurological disorder. And when an episode lasts beyond 72 hours, we enter dangerous territory. Status migrainosus, a true medical emergency. In this video, we'll explore what differentiates chronic migraine from standard migraine, the warning signs of status migrainosus, and the steps to manage and prevent these debilitating attacks. Most migraine episodes are intermittent, typically lasting a few hours and occurring only a few times per month. However, when migraine attacks occur on 15 or more days per month and persist for several consecutive months, the condition is classified as chronic migraine. In contrast, if a single migraine attack extends beyond 72 hours and is associated with severe, disabling symptoms, it is referred to as status migrainosus. This represents a more serious and prolonged form of migraine that may require urgent medical intervention. Treatment of status migrainosus. The initial approach to treating status migrainosus often involves standard migraine therapies. These include triptans, ergots, and nonsteroidal anti-inflammatory drugs, NSAIDs. If these first-line medications are ineffective, a physician may recommend a more potent analgesic, such as ketorolac, Toradol, which should be administered orally or by injection. For patients experiencing significant nausea or vomiting, anti-nausea medications, such as suppository formulations, may also be necessary. In cases where symptoms are not relieved with outpatient treatment, or if the patient becomes dehydrated, hospital-based management may be required. In an inpatient setting, treatment options may include intravenous fluids and medications. Therapies commonly used in the hospital for status migrainosus include dihydroergotamine, administered either via injection or nasal spray; antiemetics, such as ondansetron, Zofran, or metoclopramide, Reglan; valproate, Depakote, an anti-seizure medication with migraine-relieving properties; opioid analgesics, used cautiously and only in select cases; corticosteroids, such as oral dexamethasone, Decadron, which may help reduce inflammation and prevent recurrence. Steroids are generally prescribed for short-term use only, as prolonged use can result in adverse effects such as weight gain, osteoporosis, avascular necrosis, sleep disturbances, and elevated blood glucose levels. Patients with diabetes may require alternative treatment due to the risk of steroid-induced hyperglycemia. Hospital stays typically range from 1 to 3 days, during which physicians may trial different medications to determine the most effective regimen for symptom control. In some cases, medications from the dopamine receptor antagonist class may also be used to reduce migraine severity and duration. Early and individualized intervention is key to managing status migrainosus effectively and minimizing complications. Prevention of chronic migraine and status migrainosus. For individuals who experience frequent or severe migraine attacks, preventive therapy may be appropriate. When taken regularly, certain medications can reduce the frequency, duration, and intensity of migraine episodes, even when they occur. Commonly prescribed preventive medications include tricyclic antidepressants, such as amitriptyline, antiepileptic drugs, including topiramate, Topamax, and valproate, Depakote; antihypertensive agents, such as beta blockers, e.g., metoprolol tartrate, propranolol, timolol, and calcium channel blockers like verapamil; CGRP receptor antagonists, such as irinumab, Aimovig, which specifically target migraine pathways. In addition to pharmacologic management, lifestyle modification plays an essential role in preventing status migrainosus. Avoidance of known triggers is a critical component of long-term care. The following strategies may help reduce the risk of migraine escalation. Maintain regular eating habits. Consume small, balanced meals throughout the day to avoid fasting or hypoglycemia, which can trigger migraines. Hydration. Aim to drink at least 8 glasses of water per day to prevent dehydration. Optimize sleep hygiene. Ensure consistent sleep patterns. Keep the bedroom environment cool, dark, and quiet. Engage in calming activities before bed, such as reading or taking a warm bath. If sleep disturbances persist, consult a physician about short-term pharmacologic aids. Manage stress. Incorporate stress reduction techniques into daily life. These may include deep breathing exercises, mindfulness, or meditation. Avoid medication overuse. Use migraine-specific pain relievers only when necessary. Frequent or excessive use can lead to medication overuse headaches, which may increase the risk of status migrainosus. A proactive and comprehensive approach, combining medical management with lifestyle adjustments, offers the best chance at reducing the burden of chronic migraine and preventing prolonged or complicated attacks, such as status migrainosus. Can certain foods help prevent chronic migraine? Migraine triggers vary significantly between individuals, so there is no universal food that prevents migraines for everyone. However, some patients report that including certain nutrients in their diet may reduce the frequency of migraine attacks. Foods rich in magnesium, such as leafy green vegetables, nuts, and black beans, have been associated with migraine prevention in some studies. Similarly, foods high in omega-3 fatty acids, including salmon, mackerel, walnuts, chia seeds, and soybeans, may have a beneficial effect due to their anti-inflammatory properties. Low-carbohydrate diets, such as the ketogenic or Atkins diets, have also shown promise in reducing migraine frequency for certain individuals. Despite these findings, most healthcare providers recommend maintaining a balanced, healthy diet and avoiding skipping meals as the most effective dietary approach to prevent migraines. Can chronic migraine be cured? Chronic migraine is a long-term neurological condition that currently has no definitive cure. However, its symptoms can often be significantly managed and reduced. Keeping a detailed headache diary to identify personal triggers is a valuable tool in minimizing the frequency and severity of migraine attacks. Medications play a key role in relieving pain during an attack and preventing future episodes. Many patients also experience a natural decline in migraine frequency as they age. Is there an age when chronic migraine stops? For many women, who constitute the majority of migraine sufferers, chronic migraines tend to improve or even resolve after the age of 50. This change often coincides with menopause, when the production of female hormones, such as estrogen and progesterone, declines. Since migraines are closely linked to fluctuations in these hormones, hormonal changes during menopause may reduce migraine frequency. Chronic migraine and status migrainosus are not simply about pain. They're about disability, missed moments, and the urgent need for appropriate treatment. If you or someone you know is struggling with persistent or prolonged migraine attacks, seek medical care early. Timely intervention can reduce complications and improve long-term outcomes. For more evidence-based guidance on migraine and neurological health, subscribe to our channel and explore the links in the description below. Thank you for watching. Take care of your health.